working with pediatric within neurosurgery is pretty tough. It's an emotional roller coaster,
Right.
and it's not for everybody. I have students that rotate with me. I have students that shadow me that are in high school.
Hi guys, welcome to eShadowing. Happy Monday, everybody. Welcome. Today we have a very special guest. We have Mr. Tony Adkins, the neurosurgery PA, also known as the dancing PA. Thank you so much, Tony, for coming on.
Hey. Oh no, thank you for having me. Sorry, I'm gonna be driving for a little bit because I have to go pick up my daughter. And just literally jumped out of OR to go run and grab her. But yeah, I'm ready to kind of go and see how I can help assist everyone here on transitioning from undergrad into PA school.
Yes, thank you so much. Yeah, you guys, Tony had a really long day in OR and work, and he's on Pacific time. We're on Eastern time over here, so that's why it's, the difference. So he's just getting off work, and he was so gracious enough to do e-shadowing and come on. So thank you so much for sacrificing. It's been a long day, and you're still giving us the hours. So thank you.
It's my pleasure.
All righty, so we're gonna jump right in, guys. So, Tony, the last one I spoke with you, told me you were gonna pay for quite some time, even though you don't look it. Has it been like 20 years? How long have you been a PA?
I've been a PA since 2012.
Okay,
I graduated from University of Washington.
so 10 years. Okay, wow. Cause I
Yes.
couldn't believe that you had that, that many years in you. So, wow. Oh my gosh, that's a long time. So,
Yes.
So I know before you went to University of Washington, you got your master's at Loma Linda, and then a bachelor's in neuroscience in
Mhm.
California. So what made you do PA? Did you get your master's for PA school preparation for PA school, or did you find out about the PA program while doing your master's? How was your journey like?
So my journey was like any other typical person through undergrad, was focusing mostly on being a doctor. So that's all I knew as a little
Right,
kid is and when you're a little kid, you only know four major things as far as doctor, police officer,
right,
a teacher, or a fireman. And so when I was a little kid, I just wanted to become a doctor. And so when I was going through undergrad and I did my major in neuroscience, I did the MCAT a few times. I did horrible. And, I was at my end where I was like, I think I might give up. I'm getting too old for this, because I was in the military for 9 years. And then I started my undergrad education. And then I did my bachelor's, and I went into did master's in public health at Loma Linda. And so basically, PA fell into my lap. I didn't know anything about it, but now it's pretty well known now. But I didn't know anything about it, and I was like, "Oh man, this is the best thing ever! I only have to go to school for 2 years, and I can still do medicine, and I can change the things I want to
right,
do within medicine anytime I feel like it." And I was like, "Man, sign me up! I got ADD, and I'm ready." And so that's why I decided to do PA because of the attractability of being able to only do it in 2 years, and you can change it at any time, or change whatever you're doing in medicine at any time.
right. So how did you get your patient care hours?
So patient care hours, mine's is a little bit different from where it is now. Now it's like they're pretty strict on patient care. They don't really care too much about doing scribes. But mine was, I did a lot of lab work when I was in neuroscience undergrad. And I did a lot of uh, I started a club at UC Riverside that would go down to Baja California, Mexico, and do healthcare there. And so we'll go down there one Saturday out of the month, and bring down physicians, students at UC Riverside, and then other students, and then we would see patients in at our clinic. And then I went to Vietnam and did stuff there with Project Vietnam. So I did a lot of things from that area,
Yeah.
but it wasn't like paid. So it was mostly just doing and seeing patients. And so now it's pretty strict on you have that paid stuff. So that's pretty much it.
I mean, what a way to stand out on your application. Like you did all that
Yeah.
to Vietnam, did a bunch of volunteer work, even though it wasn't necessarily direct patient care and paid experience. You used
Mhm.
initiative to get that experience either way.
Yes.
Wow, wow. Okay.
Yes.
So how was the application process like for you 10 years ago?
So right. That was like a millennium, a decade ago. So, it wasn't that bad because I went through the medical school application, so it was pretty much the similar thing. So, I always say when you're doing your voluntary experience or all the different experiences, you want to limit it to some good ones. You don't want to do too many because then you got to put all that into the application. So that's the hard part is just putting everything in the application. And it takes time for you to say, okay, I got to sit down and do my application and put all this stuff in the application, and all the schools that I went to, I got to put all that stuff in the application. So those type of things take time. And so you just have to be very, on it and ready to go when it's time to go. And typically the best time to do your application is right when it opens.
Right.
And you get fired away and get it in there as soon as possible.
Yes.
And that's my key point is to always do all applications as soon as they're open. Don't wait to the deadline because that says a lot about you as an individual.
Right, right. That's very true. So, so we're gonna move on to how PA school was like. So you applied to PA school, you got into University of Washington, and how was
Mhm.
that journey, and or actually just that transition initially, going from undergrad and or even getting your master's, but then like experiencing a whole new type of learning where you're gonna be working in the field, working with patients, treating patients, diagnosing. How was that
Mhm.
learning curve starting PA school?
Uh, it was pretty tough because you have to have a lot of good time management skills
Right,
because your time management is key on trying to be successful in anything, especially being in undergrad. If you don't have good time management skills, then it's kind of hard to uh tackle everything because you get stuff that is coming from left, right, upside down, everywhere. And PA school is the it's so it's medical school truncated into 2 years. So you in medical school you have 2 years of being in classroom and 2 years of being in out in the field. And then PA school is 1 year being in the classroom trying to learn everything that the MD knows,
right,
but on a slightly smaller scale. And then you got to get out, and so you're having tests like every other week. And but the beauty of a good PA school is that they keep everything the same. So if you're learning one system in one particular area of class, you're going to be learning it in pharmacy, and then you're going to be learning it how to do the physical exam for it, and physical exam portion. So now, as long as the education of the PA program that you're going through is getting everything kind of truncated in the same blocks, then you're okay. But if it's like all over the place, then it's kind of hard to kind of stay on track.
right, right. Thank you so much for that. So, what was your favorite class in PA school? Your favorite, least favorite, hardest?
Yeah. So, I don't know. I would say usually pathology is pretty hard
Yes.
sometimes. So that's probably like the least favorite, but overall, just Cardiology is nobody's favorite across the board on everything because the EKGs are not easy to read and understand. So if you're an EKG tech or something like that, you are golden. But those things are very hard to understand at times. So those things that probably should get a hold of now. If you know how to do it, if you're an EKG tech, you are golden because you can teach everybody else.
Trust me, I completely agree. Like EKGs are not my strong point. I don't mind cardio, but even electrophysiology, I don't. I agree with you.
Yeah, I just look up at the top and say, "Up, it says it is doing good."
So, how was clinical year for you? Did you find out, or did you gain your passion for neurosurgery in clinicals?
Um, I did my pat in as far as my clinical year, it was amazing. Oh wait, hold on a second. Let me talk to my daughter real quick.
No.
Do you need me to stop anywhere? Okay. All right. So sorry, I got to go to McDonald's. But I was my clinical year was amazing. You know, for me, I always looked at clinical year as an opportunity for me to shine,
Right.
because this may be the person that's going to hire me on my next job.
Mhm.
And I need to know everything they know so I can be the best clinician I can be. And that's how I looked at every rotation. Even though some rotations I wouldn't want to be. I didn't want to be in family practice because family practice is too slow. I didn't want to be in OBGYN because it's not something that I want to do. But I looked at every rotation as a rotation that I'm going to be in for the rest of my life. And I went in there just like that every day. And the attending saw that, and so they taught me so many things that a lot of people probably never got. So you have to know there's going to be people that are going to be coming behind you, so don't mess it up for others behind you. And so that is my word to the wise for anybody that's getting into any professional school. Don't mess it up for people behind you, because that rotation is put there for a reason.
Exactly. Thank you so much. That he just dropped some gems, guys. That was yes, that was amazing what you just said. Because and I say that all the time, even for shadowing. Like even if you got a shadowing opportunity in a specialty that you don't necessarily like or that's boring, you still have to act like that is the greatest thing on earth. That is what you're interested in. Just because that's not everybody gets the
Mhm.
opportunity to do an in-person shadowing experience. So and then I've heard horror stories
Mhm.
where students go in and they're on their phones, they're not paying attention, they don't look interested,
Mhm.
they seem interested. And like you said, that's ruining it for the next batch of people, and it's already hard as it is. So, yeah,
Mhm.
you don't want to even
Yeah.
treat starting now for your shadowing as a rotation. Just seem interested or be
Yeah.
interested. So, thank you for that. For
Exactly. Um, sorry, I'm about to order something from McDonald's real quick, so my bad. This is a different type of e-shadow.
no
No.
problem. We'll go on to some questions before
All
we
right.
move on to his
Can I get a Mc? Okay.
no problem.
All right. Just one second.
Yeah, somebody said we get the real day in the life. You sure do. Yes, this is his real life, and he's really busy. We had a phone conversation yesterday, and he was telling me how his day's like, and he was like, "Oh my gosh, like thank you even for making the time for e-shadowing." So, yes. I'm just reading the comments. So if you guys have any questions, I know my audio, something was wrong with my audio. I work from home if you guys don't know. So I've also had patients tell me that my audio is weird. I think it's probably because I'm using Firefox. So
Yeah.
all
All
right.
right. So I'm back. Can you hear me?
Awesome. Yes.
Yeah, so I think that is pretty much
Mhm.
how, but as far as my rotations, everything was great.
Yeah.
I had a doc that came over that was a neurosurgeon from Missoula, Montana, and um, he taught our neuro emergency. And when I approached him afterwards, and I asked him, do you mind if I do my rotation with you? And he said, no, it's fine. So I went to Missoula, Montana for 4 weeks to do a rotation with him. And I fell in love because I in undergrad, I didn't like animals.
Yeah.
So that's why I didn't do a biology major. I wanted just to know one thing and one thing good. And so that's why I did neuroscience.
Oh, okay. Okay. So doing
Uh,
that rotation was what like led you to neurosurgery.
yeah, so that led me to I wanted to do something with the brain and spine.
Okay.
And so that led me to neurosurgery. But when I graduated, I couldn't find a neurosurgeon. But then I got I got an orthopedic spine. So
Mm,
I did orthopedic spine for about 3 years,
okay. So
as well as
cool.
emergency medicine.
Uh,
Hmm?
so straight out of school, you did orthopedic, spine, and emergency medicine.
Yes,
Okay,
yes.
but
So
the whole time, your heart was beating for neurosurgery.
yeah, oh yeah, oh yeah, most definitely.
Awesome. I'm glad you like,
Yes.
falter that you still try to go after it. It's hard as an grad to get into that specialty of your dreams, but it eventually happened.
Yeah,
Wow. So
yeah.
did you do orthopedic spine in Montana or did you move back to California?
I came back to California and I did it in California, in Orange County, California.
Okay, okay. So
Yeah.
how was ortho spine?
Orthospine is okay. It is I treat it as like a pain management doctor that can operate because everybody is in pain because it's back pain.
Right.
And so you think of back pain, everybody is always in pain. And so you do surgery on somebody that's in pain and with back pain, and sometimes they get better, sometimes they don't. And so that was like the drawback of, having, and it was a lot, it was always pretty, dark sometimes, and I was like, I don't really like this, and that's why I kept looking for neurosurgery. And then one day, the neurosurgery PA from across the street
Hmm.
was leaving his practice, and so he asked me if I wanted it, and I said, "Perfect, I'll take it." And then it's been the best thing since sliced bread, and I love it.
And that was pediatric neurosurgery where you are now.
Yeah,
Yeah.
yeah.
Oh, wow. Did you want to do peds or were you thinking adults and then it just went to the peds? That's a
No,
that's different.
yeah,
Okay, like peds.
yeah,
That's different.
yeah.
So we'll move
No.
to, of course, that was a great transition to talking about neurosurgery, pediatric neurosurgery.
Mhm,
How was that
mhm.
learning curve? Because you went from treating adults to now just only kids.
Yes. Yes. So, and it's totally different. Working with kids, you kids, they're very resilient, and you do a lot of, pretty surgeries are sometimes pretty extensive because in kids the surgeries are more brain stuff than in adults. It's the opposite. It's more spine stuff and a little bit less brain stuff.
Mhm.
But there are a lot of brain things as far as bleeds because they fall a lot and then you get big bleeds within the in what's inside the cranium, and so you got to open things up.
Right.
But with kids, it's mostly brain tumors, hydrocephalus, skull fractures, bleeds in the brain from a fall, or something called a arterial venous malformation. And so you get all these different things that kind of come with kids.
Right, right. So is that the most common diagnosis that you see in kids, the AV malformation?
No, hydrocephalus is the most common, and then there's brain tumors, and then spina bifida.
Oh wow, wow. Okay. And so your hospital, is it like one of those specialty neurosurgery hospitals where like kids from like around the country tend to? It's CHOA, right? A CHOA.
It's, it's chalk.
Chuck.
Um,
I'm
so
CHOA. Wait,
so
I'm CHOA.
no.
Uh,
so so we do a lot of specialty stuff, and we have our majority of the specialty portion is epilepsy surgery, so seizure surgeries.
okay,
But we do we are a hydrocephalus center, which is means that you have extra water on the brain.
right.
But we are specializing in pretty much anything within pediatric neurosurgery.
Okay, wow, wow. And how is it like working with kids? Because I know I can't do kids because I'm way too emotional. So like, and I would get attached to patients, but I feel like kids, they wouldn't leave my head. If I had a child as a kid,
Right.
that they unfortunately passed away or they're, have an aggressive
Hmm.
tumor or something, like I would be thinking about it
Hmm.
all the time. So how do you deal with the emotions and then especially with, your impact and how is that to not get too emotionally involved or too, into your patients? You know what I mean?
Hmm. Yeah, yeah. So, being working with pediatric within neurosurgery is pretty tough. It's an emotional roller coaster,
Right,
and it's not for everybody. I have students that rotate with me. I have students that shadow me that are in high school. I'm not high school, but college or graduated,
right,
and they're working, trying to get into PA school. So I have all gamut of students that hang out with me, but it's always a very challenging to see a kid that is like 3 days old and has a brain tumor, and they're not going to last long. Or you see a kid that you operating on because they had a traumatic brain injury. You got to take blood out to save their life.
right.
So you see a lot of stuff that it's not something that you see daily on an everyday basis. So it's for a regular person on the street, it's not for them because it's a lot of death and dying,
It,
and there's a lot of pulling at your heartstrings because you'll be sometimes the majority of the time you're the first one to tell a parent that your child has a brain tumor
right,
and we have to do surgery. There is no option of not doing surgery
right.
because we need to figure out what it is and what do we need to do to treat it.
Mm,
So those are tough talks at times.
yeah, I feel like I would cry every day. I would cry.
Yeah,
I'm so emotional with kids. I would cry every day, man. Wow. So
yeah, no, it is up there on emotional scale for sure.
yeah, like adults I can do, like the kids, like I can see certain kids, in the ER, our ER, or the ERs I've worked at, it's not like a children's hospital, so we don't see like super sick kids. So technically, most of the time they can go home, they don't look that, they're not sick, or don't have
Hmm.
aggressive tumors or anything that's so that's so overwhelming.
Hmm.
So what you do, I come
Right.
to you, so it's completely different having to see sick children in that in that condition and having to tell their parents and deal with that. I commend you so much.
Hmm.
Wow.
Yeah.
So, and that brings me to ask about how you became the dancing PA. What inspired you to do that and take children as well?
Where I grew up, when I was a little kid, I always looked to music and dance as a form of escaping from the area that I grew up in. And so I grew up in South Central Los Angeles, is where a lot of the gang movies were
Right,
made as far as like how things were within the hood basically, and a lot of those things are true to size. It sounds like it's movie theatrical, but it does happen, as far as gun violence, police activity, helicopters, so all those things were pertinent in there. And so I used music and dance as a form to kind of escape. And so one day I saw one of my patients that undergone numerous surgeries, had tumor, beat that, and then he started having a lot of neurological issues. So, one day I just said, I'm going to turn on some music and see if I can get him to dance because that kind of helped me when I was a little kid. So
Yeah.
let's see what happens. So I turned on some music, and it was "Can't Touch This" by MC Hammer. I started dancing. I got him up to dance, and then his mom filmed it, put it on social media, and then it's just pretty much exploded from that point on. And so it's been a part of what I do
Yeah.
ever since. It's I use it as a form of therapy for myself
Right. Right.
because of the things that I see. Because when you don't have of what makes you whole, what fills your cup, all those good things. You don't have that stuff. People don't come to you when a patient passed away and say, how are you doing? I am the chaplain here to take care of you. There's nothing for us. So
Yeah.
this is a form for me to kind of release and kind of just lay back, use this for myself as well as take sure they're having a good time. The parents basically start to hear or see everything that I do, and they love it because the kids are just having a blast. Who wants to see a neurosurgeon? And you're seeing somebody that is wholesome and genuine.
Yeah.
Then everybody just kind of relax, and including myself, because I'm just myself. When you see what you see on social media is not just for likes or comments. It's just me,
Yeah.
and that's what I do. And and I just did out here in Burbank that it's going to be coming out pretty soon, and it was just me just hanging out with kids doing stuff in the hospital. So it was just having a good time. That's pretty much it. Hollow.
Yeah, and that's so therapeutic because imagine these kids are like probably what's the average age, like 5, 6 years old. That's what
Um,
Instagram. Like,
as far as dancing with me,
yeah,
yeah, it's all
yeah,
over the place. So it can be, very young babies where the parents say, "Oh, I want you to dance with my kid." I'm like, all right, hold the baby, and we just like chilling. To like, adults, and so it all depends. It's just like my practice. I see moms before they deliver because they got something on the ultrasound that needs neurosurgery attention once the baby is here, all the way up into adults that are like 90 years old.
okay, okay. So it's not just kids that you see.
No, no,
Okay,
not at
okay,
all.
okay. Got it. Got it. Yeah, 'cause I'm just thinking like, that's super therapeutic, everything that you do for the kids. Because imagine, being 7 years old and a doctor, or your parents explaining to you what's going on and you still have no idea, that you have, something in your brain that's making you sick. And, it must be very traumatizing for the kids. So, and then for you to come along and brighten their day up and have them dance and get rid of the or temporary memories and feeling of that being sick. That's just so commendable.
Thank you so much. It's just something that I love to do and take care of my kids and their families is a blessing. And I treat every day like it's my last. And you taking care of somebody, it's an honor and it's a privilege. And you never take anything for granted once you're giving that a degree because you're changing lives.
Right.
And one mistake can take a life. And so
Yeah.
you listen, you respect everything around you, and don't do anything that can harm others.
Right. Right. That's true. So we're gonna go on to answer a few questions from the students. One student wanted to know how has your career how has your experience as a PA evolved since graduating and throughout your early professional career?
I just learned to be myself. At first, I thought, being, professional and doing everything like it should be done based off of, the norm of medicine. Um, me coming in saying, my name is Tony, I'm a PA, I'm going to take care of you. And okay, your diagnosis is this. We're looking at the pictures. Okay, good. This is what we're going to do. Okay, we'll see you soon. Make sure you do this and this and this. Okay, bye. And that was just, like a robot. I was just seeing patients.
Yeah.
But now I see people
Right.
that are loved by other people other than myself. There are people that go home and poop and pee just like I do, and so I don't see myself as any higher than anybody that walks in my door, no matter the age, no matter their ethnicity or their education background.
Right. Thank you. And that's basically evolving. And that's what's supposed to happen in computers. All right. Another question we have is, how do you approach ethical dilemmas in patient care when your job involves children and their parents/guardians? That's a great question.
So ethical dilemmas happens quite often in pediatric neurosurgery because, patients, we know that they have passed on. We know that there's nothing to do. They will pass away. But parents want a full bore of treatment, and it's understandable. But, there comes a point where it says, okay, now I think we are, things are futile. There's nothing that we can do. Nothing's going to change the course of this. We're changing a baby into $1 million a day baby. Run and jump into your arms, going to laugh, never going to talk. What are we doing? And so you have to have those talks of this brain tumor is aggressive. um, there's treatments that we can do to prolong life about a week or two, but there's nothing that's going to do to reverse it or take it away or make this child do anything different than being on a ventilator, being fed through a tube, and that's it. And so those are the ethical talks that you have to have. And then, but it's at the end of the day, it's the parent's ultimate decision to say, well, I want everything. And it's like, okay, you can get everything, but we're just letting you know you're just prolonging it, and that's
Right.
it.
Thank you. Thank you for that. So, to kind of branch off of that, how is your relationship with the supervising physician? Like, how independent do you work, or how close do you work with the physician?
You broke up. You say your relationship with the supervising physician kind of broke up.
Right, yeah. How is your relationship with the supervising physician? Like, do you work pretty independently now? Do you see patients on your own other than surgery, or do you still work closely? And then when you get like difficult cases like the ethical dilemma, and then kind of let him handle those. Like, how is that relationship like in the work dynamics?
Um, so, can you hear me?
Yes. Were you able to hear me?
All right. Well, on my end, it sounds like you're a chipmunk. So, I don't know if it sounds like that for everybody else, but I'm in the hills over here, so I don't have that really good reception. But
No problem. I was
it
asking
sounds like a little chipmunk. But I didn't hear.
your relationship with your
So
supervising physician.
it still sounds the same, but uh, so all I heard was that my relationship with my attending. So, but everything else just sounded like a little chipmunk.
Yes.
Uh, okay, so my relationship with my attending is amazing. He has been a supporter of me doing the things that I do, with social media, with talks all across the United States, um, with pretty much everything, because he just basically tells me that this is a once in a lifetime opportunity. Do everything you can, to spread the word of what you do. And And so that has been an opportunity to be with the individual that I'm with. And, it's very hard to find a attending that, supports you and make you better, without degrading you sometimes. Because there are attendings that are good and there's our attendings that they just shouldn't have a PA at all because they're just not great at all. And so it's just been a very good relationship between him and I. But I have three other attendings, but my main attending is the one that I'm always around. And we are like salt and pepper, Millie and Vanilli. So we pretty much everything. We just hang out.
Right. So do you work pretty independently? How's the autonomy level?
So I do have my own patients. Some days I have my own type of clinic, and then I do also see patients with him with various, post-ops, follow-ups, or consultation.
Okay. So can you explain to us a day in the life of a pediatric neurosurgery PA from when you clock in, what time you go into work, how a day is like surgery days versus non-surgery days?
So I during the day, so a typical surgery day usually starts at 7:30 in the morning, and then we have probably like 3 to 5 surgeries. Sometimes they're short, sometimes they're long. But in the morning we do Zoom rounds, and we get on Zoom at 7 in the morning, and we just kind of discuss. Excuse me. We kind of discuss all the patients throughout the on our list, or any patients that came in overnight. We discuss them and go over all the images, and then try to get a plan for what's going to happen for those patients, as well as surgeries we're going to discuss. But then the days of clinic, still in between those, I'm rounding on patients in the mornings. But then on days of clinic starts around 8:30, and then I'm usually done around 4:30 ish.
Oh, that's good.
So but then I also work in the ER on the weekends. So I usually in the ER like around 10 in the morning, and then I'm out around 8 at night.
Okay.
Uh, and and I also round every other weekend for orthopedic spine surgeon at the adult hospital across the street. So I round on those patients, and typically I'm round pretty early because I got to be in the ER within the next few hours. So I'm pretty busy. I have like 3 jobs, and then I also do the social media stuff. So, and I do social media stuff on my own. I don't have anybody that manages it. I just do it myself.
Well, I'm mind blown because I was actually going to ask you, do you work more part time because of your influence? You were on Good Morning America, like you have you make guest appearances and stuff. Like, how do you manage that and working like your million jobs?
Wait, you said how do I manage what again?
Your level of work in social media, like all the jobs that
Uh,
you have your part-time or full-time jobs, working on the weekends, the speaking engagements.
yeah, so it just, you just got to find time. And that's something that goes back to good time management skills.
Right.
If you don't have good time management skills, then it's kind of hard to get any of that stuff done. And so, long as you triage what needs to be done first, because I have a lot of different social media things that I have to do for people that come to me, or different organizations that come to me want me to do different things. So I teach a neuro block this year for Morehouse. So I have to do the PowerPoint and record on a video while I'm doing the PowerPoint. And so that was pretty tricky in the beginning, because I have to. It's a lot of work when you're recording yourself and doing a PowerPoint,
Yeah.
because you have to know how you got to edit it. You got to edit it at the same time. So that's pretty tough sometimes. I thought it would be easy, but it ain't. So I have to edit it, and then doing things like this, and so it's hard at times, and then doing different type of sponsored posts that companies approach me with. You have deadlines to do things, so it's all about time management, and you'd be surprised how many hours in a day that we don't do anything, and that we can do a lot of stuff, and I use pretty much every minute of it.
Listen, you inspired me. Well, I mean, I thought I was busy because I was wondering, like, this whole time, I'm like, you must work like part time as a PA now because, like, you're always doing something, like, some type of speaking engagement, some type of, like, appearance, like, and that's crazy that you actually work on weekends as well.
Yeah, man, I just got to keep it going.
Wow.
I'm a busy person, and that's the way I like to do my work. I like to make sure I am doing the do. I like to do it myself, and don't want nobody to do it for me because I know what I want, and I get it done.
That's the spirit. You guys hear that? That's I'm sure you guys needed to hear that. But and you have two daughters, right? You have a whole family as well. So
Yeah, and so that's why I had to hurry up and leave the OR and then go pick up my daughter to take her to work right now.
wow. And so you already had a daughter while in PA school. So how was it, backtracking a little bit, being a parent in a PA program for those that are non-traditional or have kids?
hmm So it's a little different for a guy.
Right.
Unfortunately, a lot of things get sacrificed when you're a parent,
Mhm.
and trying to tackle big things because you lose a lot of things because you're not around a lot because you're studying or you're working, and so it's not easy at all. You want to be involved in everything, but then at the same time you have to do all these things to make sure we all have a good future and everything is all planned out accordingly, because if you don't work, you don't
Right.
eat. And so if you sleep, you lose everything. So you have to, constantly make sure you are doing the things necessary to make sure you have the things needed to make sure your family don't go through the things that you went through. And that was my thing, is that, I'm gonna do everything imaginable, so my daughters don't understand how it was when I was a little kid,
Right.
and I'm gonna go to the end of the earth to do what I have to do, and I think I'm halfway there, but I got much much more to go.
Right, 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 right. Wow, wow. I'm like I'm so inspired by you. You're amazing, Tony. So, we're it's almost the end of the session, but before we go, guys, you spoke about I think 4 or 5 common cases that you can you break those down a little bit more by explaining to the students what those different diagnoses, a little bit about those different diagnoses are, and how you would go about treating the patients? You said
hmm
hydrocephalus.
So great. So yeah, so brain tumors, hydrocephalus, spina bifida, and I forgot the last one. It was a skull fractures or
Right,
traumatic brain injury. So, brain tumors, you have so many different types of brain tumors with anybody, but there can be benign and or they can
right,
be aggressive. A World Health Organization has a grading scale, where it could be from 1 all the way to 4, and 4 is the worst. 1 is pretty much nothing you need to do, and so each tumor, um, based off of their
mhm,
location, you kind of know what they are, or possible know what they are. If they are, if they look rounded on imaging, that's not that
mhm.
bad. However, if they look like somebody threw like a paintball and it just splattered everywhere, then that's pretty
Mm,
aggressive, because it looks like fingers are going in different directions. So all that kind of plays into what type of brain tumor you have, and each brain tumor can cause different issues. So You can have a kid coming in with headaches, not moving one side of their body, and then you get an image, and they have a brain tumor that's pushing on the right side, right by the motor strip,
Right.
and they're not moving their left side. And so that's a brain tumor that's causing, because the motor fibers cross over. So if
Yeah.
you have something not moving on the left, it's something bothering your brain on the right because the crossover of motor fibers. And then so those brain tumors can also produce hydrocephalus, where it's starting to back up of water. Hold on a second. All right, see you later, babe. All right. And so the brain tumor starts to back up water within the brain, and then the water needs to be diverted. So that's hydrocephalus. And so when the water needs to be diverted, you have to do things, put in different devices, or take the brain tumor out
Right.
to allow for the on the brain. And so
Mhm.
there is uh, a relationship that is apparent, which is going to be, um, there's a certain amount of brain tissue, there's blood vessels, and then there's water. And if you do anything that's going to change that ratio, then you're going to have headaches, nausea, vomiting, and it depends on where it's at. Then you're going to have some neurological issues as far as not able to open up an eye, not breathing right, if it's in the brain stem. So everywhere on the brain, you'll have a deficit, and sometimes you won't see the deficit until the brain tumor is gotten to such of a bigger, which is gotten on, which becomes so big that it's pushing on
Right.
things. Because you can have a brain tumor for a long time, and nobody would never
Yeah.
know until it's starting to cause some type of neurological change.
Right. Right. And
And then you have spina bifida. Oh, go ahead.
no, I was gonna say yeah. It's fine a bit.
And spina bifida is something that happens with kids that, it used to be thinking that you need to take folic acid, and folic acid is what causes the lack of folic acid is where you start developing spina bifida, and the neurological tissue is not closing right because in development. So don't worry about the time. I got nothing but time. So the development, the brain and the spine kind of folds up like an envelope, and sometimes it folds up and it stops, and so you have this big opening, and this big opening can be anywhere between the nose here, all the way down to the tailbone, and wherever there's an opening, part of the neural elements can be in that out pouch. And so with spina bifida, typically is mostly down in the lower lumbar to upper thoracic area, where part of the spinal cord is in this big, huge pouch. And sometimes it's like a clear pouch because it's dura, and you can see the neural elements. Be like, oh, look at that right there. And so these kids need to be taken to the OR within the first 8 hours of life. If it bursts, then the chances of meningitis coming in is
Wow.
increases, as well as meningitis will eat up a baby's nervous system, and then they'll become pretty much just vegetables.
Mhm.
And so you have to get in there pretty early and pretty soon to limit that happening. And we usually know about these things when you get the fetal ultrasounds, and then they send you to a neonatologist and they send you to a neurosurgeon. And then you have to plan the cesarean section because you don't want them going through the birth canal and pop that spina bifida, little, we call it placo. So you don't want them to pop that, and then you have CSF and neural elements all outside, and then the chances, meningitis is going to be rampant in that. And so with those kids, you close it up, right away. And then sometimes they develop hydrocephalus because the normal circulation system kind of develops what CSF develops in what's called the choroid plexus in the middle of the brain, and it kind of bathes the brain and goes all the way down the spinal cord and comes back up and gets take up here in the arachnoid granulation tissue. So
Wow.
that's that, as well as hydrocephalus, as well as tumors. So depending on where those spina bifida opening is at, is you're going to have a deficit below. So if it's in the lower lumbar, you're going to have issues with moving your feet. If it's going to be higher up in the thoracic, then you're going to have no function of the whole legs, and you're going to have a neurogenic bladder, or as well as a bowel, meaning that you need to have assistance to pee, and you need to have assistance to poop because you're going to have to get the pee out because your nervous system can't tell your bladder to pee, so you have to use a catheter all the time, usually every 4 to 6 hours, catheterizing, and then putting a catheter in overnight for peeing.
Wow. And there's no way to repair that in utero?
They have started the in utero stuff, but it's not where it needs to be yet because the chances, so you can repair it in utero, but you also can increase your chances of
Oh,
spontaneous repair the spina bifida, then you put the baby back in. So and the chances of you uh, having a spontaneous delivery because of that is increased,
mm,
but it doesn't uh, where it needs to be. So it's still almost the same. You don't we don't do it at my hospital.
right.
We're still doing it the traditional
Okay.
way because we don't see a difference right now with the data.
Okay. Okay. Thank you. Thank you for that. Okay, so it's 8:05. I know you guys had a ton of questions. Hopefully, we're able to answer most of them. But thank you so, so, so much, Tony, for taking the time, especially to meet with me and all the students and share your expertise, share your background and your journey to PA. Tell us more about your why, your what you do, and your passion and what inspires you. So we were really fortunate for that. Thank you, thank you, thank you, thank you so much. And if there's one thing just to leave off with to tell the students, one word of advice or something to share with them, what would you like to say?
It's just basically being someone that is very open to different things. Don't limit yourself and say, "I only can apply to PA school in my state.
Mm,
I only can apply to this PA school." It only takes one PA school to make you a PA, and you can go anywhere on this planet to go to PA school for 2 years and then come back. And so don't just say, "Oh, this is the only way I can go," because if you this is the only way you can go. There's so many people applying to PA schools now that it's being inundated, and so sometimes PA schools want people from outside the states. They can charge more, or because they want to get different variety of
right,
students. So you want to make sure and always know why you want to be a PA. It's not everybody's gonna say, "I want to be a PA because I want to help people." Everybody knows that, so that's a given. So you gotta come with it and start practicing what it is you want, why you want to be a PA. Is it because you didn't have good health care within your area of the United States? I want to become a PA because I see the lack of medicine within homeless populations, and I want to deliver as medicine to indigenous folk. I want to deliver medicine to people that are hanging out somewhere else. I don't know, but you have to come with it because there's way too many people applying to PA school, and the people that are going to get in are the ones that are going to be that diamond that's in the rough, and you want to be that diamond, and so you have to find that glistening stone to get you looked at versus somebody else, because the grades are not the only thing that's going to make you. It's going to be who you are as a person, how well rounded you are, and what you can bring to the table of being a PA. Is not just about you want to be in because you want to change, you want to be you want to help people. You want to be in because you want to do things and change the world.
Right, right. Can you hear me? Hello? Okay, cut off a little bit. Hello? Or some connection issues. Tony? Okay. It cut off, guys. Or I think we were having some connection issues. Oh, man. On his end. Let's see. Hello? Hello?
Yeah.
Sorry. Okay, cut off. Sorry, I couldn't hear you. I'm sorry.
Yeah.
I heard everything you
Yes,
said up
I can hear
until the
you.
end. Okay, great. Okay.
We're good.
So thank you so much. Thank you for sharing that advice. I tell the students that all the time to flex on their skills and talk about really who they are as a person and don't focus so much on grades. So thank you for sharing that and letting the students know. Oh, I think you left. We lost Tony. There you go. It's the real world, guys. Hello. I think he's logging back in. Tony? Okay, guys, I think we lost Tony, but I'll give you his IG. I think somebody asked for his IG. It's T Malone. I'll tell you how to spell it at T Malone 3. All right, so thank you so much, guys. We're at the end anyway, but thank you guys for tuning in. Thank you again, Tony. But we'll see you guys all next weekend. I know we had some little difficulties today, but we still got through it. So thank you again, guys. Bye, guys.